Well, but hot flashes are really not hot in the way you're saying. It's not like your body's, I understand what you're saying. Hot flashes, the best treatment for hot flashes, tryptophan. Because the hypothalamic function dysregulation is where the hot flashes come from. And I would say the number one treatment, successful treatment that I've seen in my use for women for hot flashes is tryptophan. It's the best.
Can you explain why?
Because it helps regulate the hypothalamic function, which is the heat regulation control. That's what I'm saying. It's different than heat, like outer heat. It's not a summer heat. It's heat regulation control in the hypothalamus. And it's really the best I've seen. Well, nothing's 100%, but consistently that's the best that I've seen.
Can you please say how much?
Everybody varies, but if you did 500 milligrams 3 times a day, that would be good. We can't quite get the powder in to Israel just because it comes in a big thing, and it's a shipping issue. Ken. So we do it having capsules, and they're 500 milligram capsules. But often I'll say take a half a teaspoon, which is about 1,500 milligrams at bedtime. Is a good thing, and maybe 500 once or twice a day. But it's probably the best treatment for postmenopausal difficulties in general and hot flashes during menopause is the tryptophan. It's really quite impressive in the total complexity of the physiology.
Can you, we spoke about this yesterday, but can you explain today the difference between the tryptophan and the 5-hydroxytryptophan?
Well, they're in the same metabolic pathway.
One moment, don't understand the question. Tryptophan,
the difference between tryptophan and 5-hydroxytryptophan. Generally speaking, the 5-hydroxytryptophan doesn't have the sleep component. I use tryptophan. Tryptophan is an excellent for helping people sleep. That's the single biggest difference. Some people, for whatever, in the metabolic pathway, do a little bit better with 5-hydroxytryptophan, but in general, I find tryptophan, in general, gives me a better result across the board for hot flashes, postmenopausal depression, anxiety, angst, and different things like that. Generally, it seems to have a better antidepressant effect as well. And it's more relaxing and so forth. So generally, my clinical observation is I like tryptophan more. I'll just put it that way. What? Well, again, if you're depressed, how long do you take it? Well, when the depression goes, you start decreasing it. If you have anxiety, postmenopausal anxiety, there's another thing, postmenopause, I'm going to call it kind of dissatisfaction. Okay? It's actually a symptom. Okay? Just get it. It's not, and tryptophan is very helpful for that. You got depression, dissatisfaction, anxiety, and just not feeling comfortable. It's really good for all those, and sleep obviously, and the temperature regulation. So they're all kind of a complex. That I see that tryptophan in general works better than 5-HTP. Some people get really sleepy with tryptophan. I either decrease it or try 5-HTP. That's kind of how I use it, but it's not a big player in the thing. And sometimes the 5-HTP doesn't work at all. That's another thing, because it's in the metabolic thing. 5-HTP is 5-hydroxytryptophan, so it's just one step in the metabolic process, but somehow not always does the body go from A to B, making it work.